Hello everyone, welcome to my channel. Today we will talk about type 1 diabetes. We will talk about what it is, in which people it is more common, what are its symptoms, what damage does it cause to our body, why it is found only in younger generation, how it can be treated, and what kind of food is good for it. You will get answers to many more questions in this video. Do not skip any part of the video because this video is all informative. Let's go to the main topic of the video. What is type 1 diabetes? When you have type 1 diabetes, your immune system kills the cells in your pancreas that produce insulin. Beta cells are what these are. Juvenile diabetes was the previous name for the ailment because it is typically diagnosed in adolescents and teenagers. Similar to type 1, secondary diabetes occurs when your beta cells are destroyed by something else, such as illness or damage to your pancreas, as opposed to your immune system. These two conditions differ from type 2 diabetes, in which your body does not react to insulin as it ought to. Some symptoms of type 1 diabetes: severe thirst, increased appetite, stomach pain and vomiting, mouth itch, often urinating, unexpected weight reduction despite eating and feeling hungry, fatigue, hazy vision, breathing that is labored and heavy, frequently occurring vaginal, urinary, or skin infection, irritability or mood swing. A child who has not been dry at night develops bedwetting, trembling, and uncertainty, quickly breathing, the aroma of fruit on your breath, belly ache, awareness loss. Type 1 diabetes causes: a hormone called insulin aids in the movement of glucose or sugar into the tissue of your body. It serves as fuel for your cells. Type 1 diabetes alters beta cells, which disrupt the process. Due to lack of insulin, glucose is unable to enter your cells. Instead, it accumulates in your body, starving your cells. High blood sugar is brought on by this, which may cause dehydration. You urinate more than your blood sugar level is higher. That is how your body gets rid of it. Your body dries out because a lot of water leaves your body with the urine. Weight loss. When you urinate, glucose leaves your body and carries calories with it. Because of this, a lot of people with high blood sugar lose weight. Dehydration also contributes. Diabetic ketoacidosis. When your body runs out of glucose to use as fuel, it breaks down fat cells. The resultant substances are known as ketones. To assist, your liver releases the sugar it has stored. But without insulin, your blood cannot utilize it. So it accumulates in your blood along with the acidic ketones. Ketoacidosis, a condition marked by excess of glucose, dehydration, and acid accumulation, can be fatal if untreated quickly. Damage to your body. The neurons and tiny blood arteries in your eyes, kidney, and heart can become damaged over time by high blood glucose levels. They may also increase your risk of developing atherosclerosis or hardening of the arteries, which can result in heart attack and stroke. Type 1 diabetes cannot be stopped. Doctors are unaware of all the contributing factors, but they are aware that your genes are involved. They are also aware that type 1 diabetes can develop when outside factors such as virus instructs your immune system to attack your pancreas. Autoantibodies, which are symptoms of this attack, are common in person with type 1 diabetes. When their blood sugar is high, they are present in practically everyone who has the illness. Along with other autoimmune disorders like Graves' disease or vertigo, type 1 diabetes can occur. Type 1 diabetes risk factors. Type 1 diabetes affects just approximately 5% of people with diabetes. Both men and women are equally impacted by it. You have a greater chance of contracting it if you under the age of 20, being white, have a type 1 person as a parent or sibling. Type 1 diabetes diagnosis. Your blood sugar level will be checked by your doctor if they suspect you have type 1 diabetes. They might check for glucose or other substance your body produces when your insulin level are low in your urine. Type 1 diabetes treatment. Type 1 diabetic are capable of leading active, healthy lives. You shall need to monitor your blood sugar levels carefully. Your physician will advise you of a range that the reading should fall into. You may need to adjust your insulin intake, diet, and activity. All people with type 1 diabetes require insulin injection to maintain blood sugar control. Your doctor will generally address three things when discussing insulin: onset, refer to how long it takes for the medication to enter your bloodstream and start decreasing your blood sugar. Peak time is the period of time when insulin is most effective at bringing your blood sugar levels down. Duration refer to how long it continues to function after beginning. Several types of insulin are available. Rapid acting takes roughly 15 minutes to start working. After you take it, it reaches its peak and keeps working for another 2 to 4 hours. Short acting or regular gets to work in roughly 30 minutes. It works continuously for 3 to 6 hours, peaking between 2 and 3 hours. After you shot, it will take 2 to 4 hours for intermediate acting to enter your system. It operates for 12 to 18 hours and peak between 4 and 12 hours. Long-acting medication lasts for roughly 24 hours and takes several hours to enter your system. You may begin by receiving two daily injections of two different types of insulin from your doctor. You could require additional shots later. The majority of insulin is sold in vials, which are tiny glass bottles. You administer the shot to yourself using a syringe with a needle on the end. Some of them are pre-filled pens. One more is inhaled. Another way to acquire it is from a pump. I advise you wear that dispenses it through a tiny tube in your body. You can choose the type and delivery technique that are appropriate for you with the assistance of your doctor. Lifestyle change. Exercise is crucial in the management of type 1 diabetes. However, it is not as easy as going for a run. Your blood sugar level will be changed after exercise. Therefore, you must balance your insulin dosage and your diet when engaging in any activity, even simple household or gardening chores. The power of knowledge before, during, and after an activity. Check your blood sugar to see how it affects you. Your levels will increase in some situations while not in others. To prevent it from falling too low, you can lower your insulin or eat a snack that contain carbohydrates. Check for ketones, which are the acids that might appear when blood sugar levels are high. You ought to be good to go if they are alright. Skip the workout if they are intoxicated. Additionally, you must comprehend how food affect your blood sugar. You may create a healthy eating plan that help keep your level where they should be once you understand the function and that protein, lipids, and carbohydrates play in your diet. You can get started with assistance from a licensed dietitian or diabetic educator. Type 1 diabetes complications. If type 1 diabetes is not effectively controlled, it can cause other issues. One's complications are the cardiovascular system. You are more likely to develop blood clots, high blood pressure, and high cholesterol if you have diabetes. This may result in cardiac failure, a heart attack, a stroke, or chest pain. Skin condition. Bacterial or fungal infection are more prevalent in diabetes. Blister or rashes may also result from diabetes. Maternity issues. Preeclampsia, early delivery, birth abnormalities, stillbirths, and type 1 diabetes are all more common in women. Retinopathy. About 80% of persons with type 1 diabetes for more than 15 years experience these eye conditions. Know of how long you have had the sickness. It's uncommon before adolescence. Maintain proper control of your blood sugar, blood pressure, cholesterol, and triglycerides to prevent it and preserve your vision. Kidney injury. Nephropathy affects 20 to 30% of individuals with type 1 diabetes. Over time, the chances rise. It usually appears 15 to 25 years after diabetes first appears. Other sub-issues like kidney failure and heart disease can result from it. Neural injury and poor blood flow. A lack of blood flow to your feet and a loss of feeling are caused by damaged nerve and hardened arteries. This increases your risk of getting hurt and hinder the healing of open wound and sores. It occurs when you lose a limb. Additionally, digestive issues including nausea, vomiting, and diarrhea can be brought on by nerve injury. You can take precaution to avoid issue. Try your best to maintain good blood sugar control. Keep an eye on your cholesterol and blood pressures. Eat healthily and move more. Quit smoking if you do. Maintain good dental and foot health. Have early exam for your eyes, teeth, and health. Foods to eat with type 1 diabetes. People with type 1 diabetes can eat any food, which is good news. The important thing is to recognize which food are high in carbohydrates so that you can adjust your insulin dosage accordingly. In the end, you are in charge of regulating your blood sugar levels and dosing your insulin. With a few additional considerations, the general dietary advice for those with type 1 diabetes is the same as for those without diabetes. Eat a lot of vegetables and fruits, include low-fat dairy and whole grains, legumes, and dairy products. Choose food that are low in cholesterol, trans fat, and saturated fat. Lean meat, fish, egg, legumes, nuts, seeds, and soy products should be substituted for red meat. Eat as many whole food as you can and stay away from excessively processed items. Fresh fruit and vegetables, whole grains, egg, nuts, beans, fish, and shellfish are a few examples of entire fruits. Even thought artificial sweeteners can be consumed in moderation. Try to cut back. If necessary, increase your water intake. The average person needs between 4 and 6 cups per day. However, this varies depending on your general health and whether you consume meals higher in water. If you are unsure of how much water you should be drinking, consult your doctor. A lot of time, stay away from foods with added sugars. Avoid food and beverages that contain no added sugar or fats. In order to determine which product is best for your needs in terms of calories, carbohydrates, fiber, and fat, compare the label with one for a comparable product that is not sugar or fat free. Food with fewer than 20 calories and 5 grams of carbohydrates per serving are referred to as free foods because they will not increase your need for insulin or have an impact to your weight. If you prefer to consume alcohol, do it in moderation. Women should not consume more than one serving per day, and men should not consume more than two. Keep an eye on your blood sugar in case you need to adjust the amount of insulin you are taking. Observe portion size no matter what the food is. The goal is to eat moderate portion of it. That is enough for today videos. In my next video, I will talk about another disease. If you have any problem or the disease is increasing in your area or country, you can message me on Instagram so that I can diagnose the disease and help you guys. Thanks for watching. Thanks